Hi, everyone. My name is Rajeev Ramchand, and I just want to express my thanks to the Elizabeth Dole Foundation, Steve and his team, for being here and for inviting me to be part of this discussion about caregiver mental health. I'm also really excited to be with my friend and colleague, Matt Miller, from the Department of Veterans Affairs. We all know that mental health is important for caregivers, and we produced a few slides just to walk you through some of what we think are some of the key data points and some of the key tips for promoting caregiver mental health. And so we've designed this exclusively for caregivers to speak to you to ensure that you can continue to take care of your loved ones and also ensure your own safety, health, and mental health while doing so. Before I begin, though, with our talk, I do want to highlight, as you can see on the slides, the Suicide Prevention Lifeline. The Suicide Prevention Lifeline, accessed by 1-800-273-TALK, is available 24 hours a day, 7 days a week. You can call if you're concerned about yourself. You can call if you're concerned about someone else. And call responders are trained to help address emotional crises. And if you dial that number and press 1, you'll access the Veteran and Military Crisis Line if you're concerned about somebody who's a veteran or a service member. When I was at RAND, I'm still at RAND part-time, but when I was at RAND in 2014, my colleague Terry Tennelian and I, as well as our team, produced a report called Hidden Heroes, America's Military Caregivers, and this was funded by the Elizabeth Dole Foundation. It was one of the first studies to actually look at caregivers, especially military and veteran caregivers, and to really examine what they're doing in the world, how are they performing their duties, and what are the impacts and supports that caregiving has on them. In 2014, and we haven't seen any updated statistics since, we estimated that 9% of US adults are caregivers. So that means that they spend some time providing unsupported or unfinanced, they don't receive pay for the care that they're providing, taking care of a loved one. Among that group, we have 16.9 million civilian caregivers. There were 4.4 million caregivers who were providing care to a veteran who is from the pre-9/11 era, and there were 1.1 million post-9/11 caregivers. So these were individuals providing care to those who served post-9/11. It was really interesting. There were some differences between the groups. So for example, for our civilian caregivers and pre-9/11 military caregivers, we saw a lot of adults who were taking care of their older parents. And these parents who were veterans or non-veterans had conditions like cancer or dementia and Alzheimer's disease. In comparison, the post-9/11 caregivers were much younger. Frequently, they were spouses, but they could also include parents, or they could include family members and friends who were taking care of someone that they loved who had suffered an injury or an illness when deployed oftentimes. And often those were mental health conditions like post-traumatic stress disorder or depression. What was really important in our study was when we looked at the mental health effects of caregiving, we noticed that the post-9/11 caregivers, there was a lot of depression. So again, this was in 2014, so this is pre-COVID. So we already knew that caregivers were, I don't want to say suffering, but that caregiving was impacting them. So around 40% of the post-9/11 caregivers met criteria for depression, and that compares to around 20% of caregivers to anyone. And the non-caregiver sample, which we also included in our study, it was only around 10% of those who met criteria with depression, which is pretty consistent with the national average. So we knew that caregivers already, prior to the onset of this pandemic, were at increased risk for some mental health concerns. We dug a little bit deeper to understand, well, what about caregiving increases risk for depression? What types of caregivers are more at risk, and which types of caregivers are less at risk? And among those that we looked at, what we found were that, and this slide the bold didn't transfer, but that's fine. The two most significant factors that increased risk for caregiving was the time spent caregiving, so how much time caregivers reported providing those caregiving duties, as well as helping the care recipient cope with stressful situations. So that might be really prevalent among caregivers who are caring for somebody with, for example, post-traumatic stress disorder and trying to help them navigate the stressors that they experience in their day-to-day life. So this really suggested to us and led us to make some recommendations about the importance of self-care as well as the importance of respite care, and how providing a break from your caregiving duties, having somebody else maybe assume those responsibilities, or maybe have somebody else assume some of the responsibilities that you do when you're not caregiving, things like going to the grocery store, doing laundry, running errands, trying to find support for those activities so that you have time to yourself to recoup, if you will. But times have changed. As I said before, that study was done in 2014. We have a lot of things going on right now, and a lot of causes of stress for everyone, caregivers included. So we have, as we're here today, talking about COVID-19 and those health concerns. There's anxiety about those concerns. There's associated with COVID an economic downturn, including some massive reductions in employment, some like that we've never seen in recent history. And that's very stressful. We know that losing a job can be very stressful, can be very traumatic even, and is a cause for concern for many people that could exacerbate perhaps, or that can exacerbate or instill new mental health conditions. There's also now increased discourse and public awareness, particularly after the video publication of George Floyd's tragic death, about systemic racism in our country. And I think as a nation, we're coming to terms with that, coming to terms with our history, and it's creating a lot of stress as well, especially for communities that have been disproportionately affected, including the interweaving of the pandemic with an acknowledgement of systemic racism and racial disparities, as you just heard Dr. Fauci speaking about. And then there's this general uncertainty. We can't predict the future. We have no idea what's happening. We have some glimmer of some forecasts of what's going to be happening, but it's really important for us to think that these pandemics intertwine, and there's just a lot of uncertainty out there, and uncertainty is always a little bit distressing. And so that brings us to the title of our symposium today, which is Caregivers, the Hidden Heroes on the Front Lines. So we recognize that caregiving is taking its toll. Not only are caregivers assuming their caregiving duties, but they're also running household errands. They're also meeting the transportation needs of the care recipients that they're working on, maybe taking them to medical appointments that entail going to hospitals, public settings. They're oftentimes, especially for our post-9/11 caregivers, they have kids at home, so they have parenting responsibilities. And we won't even go into kind of the effect that all this uncertainty and COVID-related stress is having on kids, but parenting is also a little bit more stressful. They're also taking on an enormous amount of teaching. We've seen, even for online classes, that parents are playing a much larger role in their kids' education, ensuring that their kids are keeping track of their Zoom classes and their homework responsibilities, but that's another added responsibility. And again, a lot of our caregivers are actually employed, so they're managing and juggling all these responsibilities while also fulfilling their work responsibilities at home. What we're concerned about, health professionals, and what we're concerned about among our caregiving parties is the potential for burnout. This is not kind of a term that is used loosely, and as I've been researching it, I think that this multidimensional concept of burnout is really important. Oftentimes, we just focus on the first element of burnout, which is this emotional exhaustion or feeling depleted. But people who have studied burnout have looked at two other features that are really consistent with people who express burnout. The first is cynicism, that the caregiver, healthcare providers, or caregivers might start to feel negative about the care recipient, hold negative responses or reactions to the care recipient's behavior, and really start to distance themselves and be upset with the care recipient in certain ways. And then this reduced personal accomplishment, just feeling that you're not effective, that you're not doing everything right, that you're not doing anything right with your caregiving responsibilities, which can also kind of exacerbate this feeling of burnout. And we really want to prevent that. We want to support caregivers so that they don't reach the stage of burnout. And if they do, that they have resources to enable them to get back to being effective members of society, feeling good about themselves, and assuming their caregiving duties and responsibilities. Early on in the pandemic, in August, well, so not that early on, but in August, the Centers for Disease Control and Prevention produced this report on mental health and substance use and suicide ideation during the COVID-19. They interviewed a sample of respondents in April, re-interviewed them in May, and then again in June. It was a non-probability sample, so we don't know to what extent it's generalizable or representative of the entire population. But what was so interesting and important to me about this report was that they asked about caregiving duties and responsibilities. And among their sample of over 1,000, 26% of those interviewed at June reported that they were providing unpaid care to another adult. So they were adult caregivers. So we don't know if they were military or veteran caregivers. All we know is that they were caregivers. In this study, they looked at are new mental health concerns emerging among the caregiver population, and they looked specifically at anxiety disorder, depression, substance use, primarily alcohol use, and serious thoughts of suicide. And unfortunately, they found evidence that caregivers were at greater risk for experiencing an onset of each of these conditions. So even though even controlling for factors that may look similar to the general population, caregivers were more likely to report feelings of anxiety, more likely to report feelings of depression, more likely to report substance use, and very concerning, as somebody who's studied both caregiving and suicide prevention, serious thoughts of suicide, an increased risk of feeling serious about thinking about suicide. So we know that caregiving is stressful, we know that caregivers were at increased risk, and we know that COVID has exacerbated that risk. So what can you do? I think that it's really important, and these are evidence-based, evidence-informed practices of what caregivers can be doing to take care of themselves during these trying times. The first is the importance of sleep and sleep hygiene, relaxation exercises, and I'll go through some resources, scheduling, trying to take that time in your very busy and chaotic schedule to try to schedule some fun and pleasant activities, whether that's going a walk. With this past weekend, I had a good friend, and we scheduled time for she and I and my dog to go for a nice long walk, and that was just really nice to just spend some time to do that. It really made me feel good. Physical exercise, and then finding that social connection and support. Sometimes you do need to reach out and find somebody else who will have the time to just have a Zoom call or just talk to them on the phone, just to catch up and just to let them know that you're there for them and that they're there for you. But you can also access, sometimes self-care isn't enough, and maybe you need some professional help. There are employee assistance programs for people who are employed, sometimes spouses, EAPs. Spouses can take advantage of their loved ones or their spouses' EAPs. Primary care doctors are increasingly astute at recognizing mental health concerns and helping treat mental health concerns. And then there are mental health specialists, which include anyone from clinical social workers to counselors and therapists to psychologists and psychiatrists. And here are some resources. What I told you before were just some of the examples of things you could do to take care of your health. But again, I'll reiterate, the Suicide Prevention Lifeline is a 24/7 resource available for people when they need it. Really impressed by the resources that were compiled in Mass General's COVID-19 Mental Health Guide. There are relaxation exercises that you can find online that include things like deep breathing, visualization, progressive muscle relaxation. The Suicide Prevention Resource Center has a COVID-19 resources that you can access. The CDC offers tips for better sleep that could be helpful. And then finally, if you're looking for a behavioral health clinician, SAMHSA has on its website a behavioral health treatment locator for finding formal treatment, for finding places where you can access formal treatment for mental health care. And from our perspective at NIMH and the research community more broadly, what I think it's incumbent upon us to do now is to think about the impacts that mental health has on caregivers specifically, to develop and test interventions that include caregivers so that we purposely include caregivers in our trials, but that we also start designing interventions and prevention programs exclusively for caregivers, recognizing the unique kind of struggles that they face, as well as the challenges, and try to find ways to overcome those. It's really important that we take the programs that we know work and disseminate them to communities. One that I really like is something that's done by NAMI called Family to Family, and it's a peer support program for family members who also have another family member with a mental health concern. It's been studied, it's been tried, and it's been shown some really positive effects, so getting those out into the community. And then finally, we have to include those who have lost who have lost someone to suicide, and they know about them, what we call these survivors. In our interventions, we have to include caregivers in our interventions to help us design interventions, for them to tell us their stories so that we can use that information in designing our interventions to help promote caregiver mental health. So I'm going to turn it over to my colleague Matt now to talk from a VA perspective. So thanks, Matt.
Thanks, Rajeev. And I am here to back you up on, from a VA perspective, of many of the things that you said. You and I have had the privilege of working together since I was the director of the Veterans and Military Crisis Line, and now the director of suicide prevention for the VA. And one question that I'm often asked is, well, Matt, what's the relationship between caregivers and veteran suicide prevention? And if people were listening, they heard a lot of connections in what you were saying and what you were just walking us through. Veterans Crisis Line, one of the most frequent calls that we receive is actually from caregivers looking for information, looking for resources, looking for support and assistance. Within VA suicide prevention, you probably heard from Mr. Wilkie and from Dr. Davis how important the caregiver is to the VA and to our veterans. Your numbers, Rajeev, your first slide, 5.5 million caregivers, military related. So we really look at two aspects with regard to caregivers and are passionate about getting the word out on these two aspects. Number one, resources for caregivers, and that's a lot of what you talked about as well, Rajeev. With regard to resources for caregivers, we have the Caregivers Toolkit for Suicide Prevention that gives a lot of good information about risks and signs to be aware of and to watch for, and resources as well to engage. We find that one of the biggest challenges caregivers face is starting the conversation in many cases. And then in starting the conversation, what do I do? What do I do if we go somewhere and I don't know what to do about it? We also talk a lot in the Caregivers Toolkit about lethal means safety. That's an important aspect of suicide prevention and highly research backed. And the importance of the caregiver getting involved in lethal means safety planning. Applied to firearms, 70% of veteran suicides are secondary to firearms. So caregivers getting involved in things like safe storage for firearms. The other aspect, in addition to giving resources, is giving support. We have the Caregiver Support Line, we have Coaching into Care, we have the Veterans and Military Crisis Line. What I'd like to encourage out of this discussion, what I love about this isn't just focused on here's some resources for you to do the excellent work of caregiving more like you already are doing, but it's also take care of yourself. And here's some resources for and the importance of taking care of yourself. Along those lines, I think, Rajeev, you have one last point that you were going to bring home about self-care, right?
I was?
I thought so, yeah. I thought we were going to talk about the importance of self-care and the importance then of making sure that you are prioritizing that self-care. Go ahead.
No, I think that's important. I mean, that's critical for caregivers. If you take care of yourself, you can do your caregiving duties better. What we don't want to see happen is you to kind of neglect yourself. You start to feeling that you can't accomplish your caregiving duties, that burnout that we talked about, and then this spiral, this cyclical spiral that is really hard to get out of. So early identification, sleeping well, eating well, exercising, those things that we talked about before, you know, just really enable you to be that caregiver that you want to be and just be that person and be there 100%.
But giving the caregivers permission to think along those lines and to pursue those important things in addition to the resources and the services they're providing, really important. Appreciate you highlighting that.
Absolutely.